Welcome back to McLaren Port Huron's Today's Health, and we're talking with board-certified OBGYN, Dr. Stacy Tremp, and we're continuing to talk about endometriosis. So what are the symptoms of endometriosis?
Typically, a patient will come into the office and complain of pain with their periods itself, and sometimes just a generalized pelvic discomfort. Some patients on extreme cases will even complain with pain when they have a bowel movement itself. So pain is the biggest thing. Some of them will complain that their periods are very heavy in addition.
Can endometriosis cause the amount of pain that will send a patient to the ER?
Possibly, yes, and there have been patients who don't know that they have this condition itself, or they've kind of seen some people, they've been given some medications and they're trying them, but the pain can become extreme enough where they feel like they need something stronger for pain, or they really feel like something else is going on with them, so they need to be evaluated.
Something's really wrong.
Yeah.
So how do you make a diagnosis?
So truthfully, the diagnosis is made, you need to do a good history and physical, but textbook way to diagnose endometriosis is actually to take the patient to surgery, to take a laparoscope and place it through the skin and into the peritoneal cavity and see these implants of endometriosis that are classic in appearance itself. Sometimes you'll see that adhesions or scarring that we talked about previously, and on rare cases, because I believe that endometriosis is a pretty deep disease, so sometimes the surface of the peritoneum or the inside of the abdomen can look very normal, but these patients still have very bad discomfort. And I warn them that if I go in and look and I don't see anything, that doesn't necessarily mean that you don't have this, but sometimes there's lesions underneath that tissue that are hidden because of the deep nature of endometriosis that I can't really truly say. But classically, textbook-wise, is to go in, see endometriosis implants in the pelvis, and some people even say you need to do a biopsy so you can see that classic appearance of that tissue to say you truly have endometriosis.
So what are the treatment options then?
So there's a couple of different treatment options. Usually we'll start with NSAIDs, just Motrin, ibuprofen, Tylenol, Aleve, those over-the-counter products to see if they're going to help with your discomfort during your periods or when you're having pain. The other option is birth control pills. Actually, they can control the cycle, and if you do a lower dose birth control pill, you get a lighter, shorter period. That in combination with your NSAIDs is first-line treatment. The Mirena IUD is actually a treatment option for patients with endometriosis pain. There's a newer medication on the market called Orlissa that is a medication that kind of shuts everything down a little bit so you don't have that stimulation, thus decreasing the pain that you're having from endometriosis.
Well, I'm thinking about, you said in the first segment that these endometriosis is around a long time. So can you take NSAIDs and birth control pills for a long period of time?
You know what, you can, and that's a good question. There's actually some studies out there that state the longer that you're on the birth control pill, it will decrease your risk for ovarian cancer. So that's a nice option for patients, because I think many women in this day and age are very fearful of the pill. They're very fearful of hormones themselves, and I think that we need to look at why we're using the option itself. If we're using it to treat your endometriosis, are we using hormones to treat your menopausal symptoms? Taking that all into case too, or into play.
Well, and even the NSAIDs and things, you know, in terms of taking them a long period of time, people are...
Yeah, and sometimes people don't need them for the entire month. Sometimes there's a couple days that are quite bad for them, and if we can get their cycles under control with the Mirena or with a birth control pill and their symptoms are better, then they're not needing to take those NSAIDs all the time either. So, do you ever have surgical treatment options? There are some surgical options for endometriosis. I think that they are not the best options, but there are some studies that state if you go in with the laparoscope and actually burn or fulgurate these implants themselves, then in theory they should stop being painful for the patient, but not always does that work for that patient itself. And like I said before, sometimes you'll need to resect a large portion of the inside of the belly just because that endometriosis is such a deep disease. Some implants are on the bladder and you can't resect or burn the bladder. Some are on the inside of the pelvis where important structures are, so you can't necessarily take those guys away.
And does endometriosis grow back?
In theory, no, it shouldn't, because those implants, once they're burned or once they're resected, they shouldn't grow back, but there's always more, I think, where that came from itself. So
So can you tell us a little bit about how you would do the surgical procedure? Do you use the Da Vinci surgical robot?
I do, and so if the patients are done with childbearing and they've been dealing with endometriosis and painful periods for quite some time, they might elect to have definitive treatment with hysterectomy and taking one of their ovaries. Depending on the age of the patient, I try to counsel them to leave at least one ovary so they have some hormonal support. There's good studies to suggest that if we take one ovary in the uterus, that other ovary won't produce enough to stimulate that endometriosis pain, and their pain will be improved. So the Da Vinci robot is a nice option that we have at McLaren Port Huron to do a minimally invasive procedure for patients who might not get that minimally invasive procedure, have to have an open procedure because of scarring or difficulty with a procedure, and not a candidate for a vaginal hysterectomy.
So what are the benefits of the surgical robot, minimally invasive?
Healing. So if you consider, back in the day, we did a lot of open procedures. So an incision on the belly, they were in the hospital a couple days, and then your return to bowel function was longer. Everything kind of took a little bit longer to heal. When we do a Da Vinci robot, we have 4 incisions on the belly. So one above the belly button, 2 across from the belly button on the side, and 1 in the upper quadrant of the left side of the belly, up by kind of where your rib is. So these 4 incisions, that's where majority of the surgery is done. And it's a much less incisions on your belly. There's not an opening of the abdomen, and the patients are usually out of the hospital within 24 hours. So it's much easier for the patient to bounce back from this surgery than when we have to open their abdomen.
So what kind of recovery is there if you do this minimally invasive surgery?
Depends on the patient, I will tell you. I think some patients really bounce back, and after 2 weeks they're feeling good and they're able to go back to work after the surgery is completed if we're doing a hysterectomy. If we're just doing a resection or a fulguration or burning of those implants, usually about a week they'll feel better and they can go back. But for a hysterectomy, I've had patients go back as early as 2 weeks, but truthfully, my spiel to my patients is that if you have an organ removed, you probably should take a month off work. Not necessarily that they need the whole month, but they probably should plan for 4 weeks off of work, and then if they're feeling great at 2 weeks, we'll send them back at that time.
Great information. We're going to take a break, and then we're going to talk about uterine fibroids.
Sounds good.